Welcome to Beneath the Branches, the podcast for the Adoption and Foster Care Clinic where we sit in the shade of shared experience. The heart is normalized and belonging is built one honest conversation at a time. Adoption, foster care, or kinship placement brings deep joy and real challenges, and we're here to talk about all of it. The hard, the heartwarming, and everything in between. So grab a cup of coffee, take a deep breath, and join us as we hold space for the messy, beautiful work of building connection beneath the branches.
Welcome to the Adoption and Foster Care Clinic podcast. Today we have our resident occupational therapist, Amy Elmore, with us today, and I'm just going to ask her some questions so that y'all can get to know her, get to know what she does here at the clinic.
Yes.
So
good luck with getting that in the time you want it in.
I know, right? Amy has been with me for 21 years in the clinic. We started together over at Children's of Alabama when she was working there, and joined our clinic again 21 years ago. But she's been an occupational therapist for 29 years.
Almost 29.
Yes.
Yeah.
So, and has a lot of specialized training as well. So I kind of want to talk about that today too, like your specialized training, and you're just a good, unique fit for the clinic.
Okay.
So first, let's just talk about what is occupational therapy, because people may not know the basics of it.
Right. And a lot of people don't. But in our world, we kind of look at it in any people. So pediatrics, it can be adults. Occupational therapy helps people find a way to become more independent. So for a child, it may be just being able to get up in the morning and getting to school. Mm-hmm. So them being able to be regulated enough to get ready. So also, one of those things would be eating and feeding and schoolwork. And so they want to be able to do those things every day in that everyday life category. So sometimes OT will talk about activities of daily living. Mm-hmm. And so for a child, it would be being able to work through their school day or handle preschool, or how do they interact with their parents. It could even be, we know a lot of times they want love and attention, but do they know how to get the appropriate love and attention? So it may be helping them with that. Later, it also works in coordination, but we want them to be able to be coordinated to be able to be successful at home with their peers, with their siblings. Mm-hmm. So it can work in all the areas.
Mm-hmm. And it's a different, when we serve just one set population, adoptees, children from foster care, kinship care, and our kids do look a little different, and the treatments, their presentations are a little bit different.
Right.
And that's been fun for the last 21 years to explore that, with you, and kind of learn from you, like, how do we view our children through this unique lens of often having a background of trauma and transition.
Yes.
Yeah.
And one of the reasons why I chose to do occupational therapy, and it helps us in this setting, because one of the things when you look at the world of physical therapy, occupational therapy, and speech therapy, I always call occupational therapy is the center circle. PT's on one side, speech is on the other, and we overlap in both of those areas. And there was so much that I didn't want to work on. Just one thing I like about what I do is I didn't want to work just on communication. I didn't want to focus on just how they might move. And because with our kids, I need to look at all those areas of development. Mm-hmm. And so it really fits in with the reason why I chose to become an occupational therapist, because I know I've got to look at the coordination, but I need to know how they're interacting with their peers and how they're going to handle life. And then I need to know how they're communicating, because that impacts so much of their behavior and their regulation. And so as an occupational therapist, I know I've got to look at the whole gamut of things in our facility especially. But I take this into the world where I help in schools and daycares and homes. Mm-hmm. And it's something that I can't take out of me. I look at the whole picture no matter what. Mm-hmm. And that's part of the occupational therapy aspect of it. And so I find myself a lot of times I'm looking in our setting much more at their communication. I'm looking at how are they moving, because all of that plays in on, can they sit, or are they able to sit and attend to something? It's not just about what everybody sees as sensory. Mm-hmm. Could have so much more going on. And sometimes it is sensory when there isn't anything else. And so, but if you don't look at all those areas, then you don't know.
And it's interesting, isn't it? Like in our kids, those areas are impacted definitely from if they've had a history of neglect or they've had a history of abuse or just a
Right.
history of a lot of transitions, development is
Right.
impacted.
Right.
Emotional skills,
It almost
relationships.
freezes it. It just
yeah.
sort of freezes it in time.
Mhm.
And then the more hits, as we kind of say, and the more red flags that happen to them, they regress. And so they lose some skills they may have had. And now we've got to find, well, where's that baseline? And then
Yeah.
help them to figure out how to move forward.
Yeah, and I think, when I think of what you do, I think of it in kind of like 5 areas because it's hard to put them all under one umbrella. So if it'd be okay, we could just talk through those 5 areas and kind of just
let's
do
do
an
that.
intro to like at least the language that you use and we use back and forth when we're assessing a child with the backgrounds that our kids have.
Okay.
The first one I kind of thought of was maybe like sensory integration.
Okay.
Like, well, what the heck is it?
Exactly.
Why is it important that we know if our kids have difficulties with
Okay.
sensory integration?
And in the world right now, we kind of just discuss it more as sensory processing. So it kind of helps
Okay.
if we think of it as the word processing.
Yeah.
How do we process what's going on around us through our senses? So everybody knows the basic, your sight, how we take in sight, sound, smell, taste, touch. But when we think about that, we think about, so if you're sitting in a classroom and you're trying to focus, but there's a lot going on. So we're in a kindergarten classroom that's pretty busy, got lots of nice colors and things are all over the place, and our kids and our friends that are moving around. Well, now you're seeing a lot of movement. So it's the way you take in information through sight. And then what are you hearing? Is it the air conditioning vent? Is it the kid tapping their foot? Is it the speaker coming over? And then you've got the smells, because there's, smells. Got lots of smells.
In the
Everybody
school.
just bring in the school and lunchroom. And then you've got, touch. So a lot of our friends don't know personal space. So we're going to kind of touch. So, and it's the way even our clothes feel. Like there's a reason out there right now that why a lot of our clothes don't have tags. Because a lot of us, it irritates us, and that's
Yes.
a tactile processing. And then there's movement oriented of what whenever we're moving across different surfaces or just playing, and right for our kids playing in different things. And there's reasons why as adults we don't like long car rides, or especially being in the back seat, or we don't like amusement parks because we haven't used that part of our system to regulate all that movement. So it affects us differently. So sensory processing as a whole takes into effect all of those things, how it comes together and how we determine what we're hearing, feeling, seeing.
Yeah.
And so sometimes we do it well, and I used to say, and sometimes we don't do it. Like when I get up in the first thing in the morning, and if there's a lot of noise and there's a lot going on, I'm super dysregulated. I know I need to wake up slow. I need less noise. Don't ask me to do something. I'd love that cup of coffee. So, and that affects all of us. But if my clothes, if it's a day where I'm having a hard time, then I need my clothes to feel comfortable.
Right. Yeah.
I need my shoes to feel comfortable.
Yeah.
So-
Otherwise, you kind of get irritated.
You get irritated, and you get irritated quickly.
And then that can impact your relationships and the way you're presenting with others and the way you're
others.
connecting with others.
And it looks like you might be more defiant when you're really just
Yeah.
uncomfortable in your own skin,
Yeah.
or in your own
Definitely.
clothes for that matter.
And I think it's interesting that not everybody, it's not always too much sensory input. Sometimes it can be too little. So can you talk a little bit about sensory
Yes,
seekers and
yes.
sensory avoiders? That there's two sides of that spectrum.
Exactly. So sensory avoiders are going to be more of, so I for instance, do not do well with sounds.
Yeah.
I'm very sensitive to sound. So I know if I'm going to be in an environment where I'm trying to work, I need to have sort of a mundane sound. But if there's voices coming in the background and different conversations, it alerts me to listen because I think, is there something I'm supposed to do?
Okay.
I might also be the mom in me. I don't know. That's just kind of where we fall. But it's the same idea. So I need to move away from that. So that's the sensory sensitivity where I know I need to get away from the sound in order to function okay. So it also then for sensory seeking, sometimes you need more to regulate. So I think of that more of the pressure. So kiddos who love to do pushing and love crashing, they love the way it feels within their joints and then their muscles. Whereas light touch feels more like a pinprick. Or and it's also almost the opposite, like what was that? So like for instance, kids who like to be tickled on their back, they like the light touch. but you know really quick whether or not your child wants a light touch or that heavy pat.
Exactly. And I can see how that, again, would really modulate or not modulate behavior.
Right. It's going to go either way. And in a lot of, even myself included, we all do that. There are things that we like different at times where we like that deep pressure. Like I like sometimes a heavier blanket on me when I'm resting, or if I'm curled up on the couch and I'm trying to calm. But there are also times where I feel like it's smothering me.
Yeah.
So we as humans change very often with that. And it depends on what's going on around us. How safe and secure do I feel in that moment? Do I have a lot of anxiety about something coming up the next day at work, or a child that I can't meet their needs right now? And so as a mom, I worry, why can't I? And so that makes my anxiety go up. So it changes.
It's kind of like it's a great tool that I see that you add to the clinic is because a lot of our children that are coming in later for support, the families coming in for support, they're coming in a lot for behavior dysregulation.
Right.
Right. And it seems like it's such a big tool that we can use to help parents modulate behavior and help the child succeed for all the things we're asking them to do.
And letting them not realize that it has to feel like therapy, but feel like a form of attachment. So I feel like what I do here very differently than I would anywhere else is using those strategies to form bonds and attachment. Because see, for a child who didn't know if they're not able to tell us if they like the light touch or the heavy touch, but when the parent figures it out, you've just had an aha moment.
Yeah.
Because they've now met a need the child can't verbally tell you or explain that it felt good.
Yeah.
So it's one of those things like when they realize they need a big bear hug and you give them a big bear hug, but you let them linger there.
Yeah.
Rather than, okay, that's enough because the parent can't handle it.
Right, yeah.
But then if you do it, then the child goes, oh, that felt great. But they calm down and you've just created an attachment and bonding moment through the sensory activity. And it's better when it doesn't feel like therapeutic intervention.
Yeah.
It needs to feel like part of their everyday life.
Yeah. Yeah.
And that's what I strive to do, I think, within this clinic is what are the strategies we can use from a sensory processing, sensory activities level that they can then do at home in their everyday life. Because I live in the real world. I'm not able to do a lot of extra in my own home. So why would I ask another family to do that? Exactly. I want it to be something like I had one family who said we were trying to come up with a way to do some sensory activities before they got in the car because they needed some help transitioning from the home to daycare. So they put like the small little handheld, little one-handled trampoline right by the car.
Oh, there you go.
And so they jump, and then they jump and sing a song together, and then they get in the car. So the child sees the mom as, you just met my need, you put a trampoline here.
And you're fun.
And you sang a song, which was our favorite song, and then you got in the car, and you just helped with the transition. You made them safe by giving them that deep pressure, and you provided a strategy that they didn't even know they needed. And
it decreases the, the resistance to getting in the car, which can cause a big fight.
Right.
And cause a meltdown.
Correct. Because they didn't want to get there in the first place. Right.
So what you are often, I know this is a term it took me a while to understand, but what you've done for that child in that moment is you've created what we call a sensory diet, which has nothing to do with food.
Right, nothing.
But it's feeding the body what it needs.
Right, feeding the body what it needs through senses,
yes.
Whether it can be smells and the touch and sight. Exactly. So we knew they needed some deep pressure, so we provided it. One thing that I have found outside of this clinic is that the sensory diet gets very confusing for families. And so one of the strategies that gets left out is being told when to provide these activities.
Okay, yeah.
So one of the best things I feel like we do as a team is understanding their day and everything that goes on, and you figure out what time of day do they need some of these strategies implemented, and what are the tools that you can actually use at that time, because maybe you're in the car, or maybe you're about to head into the grocery store, and the grocery store is going to dysregulate them, but you got to get milk and bread.
Yeah.
So that kind of same idea. That's where people mess up.
You know what I like the most about your assessments for sensory processing is when I am thinking about the diagnosis of ADHD. So like if a child might have a diagnosis of ADHD, there's one thing I really want to rule out. and that's sensory processing difficulties. So I feel if you've ruled that out, then I have a lot more confidence in my diagnosis of ADHD.
Right.
I mean, there's other things we're trying to rule out, anxiety and things like that, but sensory processing is a big part of feeling comfortable with starting a child on any kind of ADHD medication or interventions.
And we have to try it first. So we have I have to come up with some strategies that the parents can really implement in order to see, did that calm them? Did that meet the need that the child was seeking?
Yeah.
Or did it create that safe feeling that they did need, which then decrease the anxiety, which then decreases that attention deficit type presentation. Exactly.
Yeah, exactly. I think we could spend a whole podcast on each one of these. So, but we'll have to come back to them.
Yeah, we'll do that sometime.
But let's go to the second big area that you help us in, and that is feeding difficulties.
Yes.
So why do our kids even have feeding difficulties? Maybe we start there.
Why do they? So either our families, and with a lot of our kids, so there's several things that happen.
Yeah.
So it's either in utero, so different exposures to different things, or the stress that mom may even have during that time causes that dysregulation of whether or not they can even handle foods. Let's see, think of like whether or not you're a picky eater. Can even create that. It can create whether or not you overstuff, which was again that sensory seeking. You're trying to get that feeling of a full mouth, but then that creates an oral motor problem because you're going to choke. Where do you think the food's going to go? Where it's going to come right back out, or they pocket it. But then the other thing that we tend to notice that why we have to do feeding is because a lot of the families and the kids come from limited amount of food or not the right kind of food. It can be
sporadic food intake because it's not always offered.
Food that's inhaled very quickly. So because of anything from purees and porridges and milk that's thickened, or just from even a lot of our families in the foster system that may have been in a system of, like you said, sporadic foods or only very easy, quick foods to fix. So those are kids that are going to be even more of a picky eaters because they've not ever tried a texture. And then you've got texture issues of fruits and vegetables, different meats, how you prepared it. A lot of our kids, even if the mom ate certain types of foods in utero a lot, so like the spicy, or like for instance, I loved fruit and pizza with one of my kids. Well, that was their staple item for those first years of their life. Was they loved all fruit and pizza was the main staple. Now, granted, I had to teach them to eat other things, but yeah.
And I think too, in our children who have a history of living in an orphanage, two things come to mind. Is one, if a child does have difficulty going from the bottle to solid foods, when you have a room full of kids, it's just really hard to slow down and teach how to eat solid foods. And so a lot of times that's just skipped over and let's just keep them on the bottle. So you have like 2 and 3 year olds still on the bottle that are newly adopted. And so once you get to that point, you've got a lot of sensitivity in your mouth. Right.
And a complete lack of oral motor development.
Yes.
And so, and if they come from, they were hungry, so now if we just go to purees and they're able to just suck it down, now we've left out what the tongue can do. We've left out, munching, chewing, and then we can't do textures. And then we have the other end of maybe they didn't like that person didn't make them feel safe that did feed them. So now we don't like things coming toward our mouth. So forget a spoon, but much less a toothbrush. None of that is going to be welcome from another person to come toward their mouth. So they're very averse to that. And in this population, I have to admit, from my years of doing feeding therapy before being solely in this practice, it's very opposite. I have to be very mindful of the trauma, neglect piece, because if I think of it this way with feeding, any child who has a delay in what they can and cannot eat has been some form of trauma or some form of a neglect that got them to that point. Whether it was through what we typically think of trauma and neglect, it could just be this was all there was. And it still could be out of love,
Yeah.
but not knowing what to do next.
Yeah.
And
And
what that does to
sometimes
'em.
too, like you figure like in in like particularly an orphanage, kids are fed on a schedule. Like that, and then so when they're hungry, it may not be time to eat. Or if they're not hungry, they've got to eat. And there's only like maybe 10 minutes to get fed because there's so many other kids. So that
Right.
kind of, when your brain is learning, am I supposed to be full or am I supposed to be hungry? That's a part of your brain that is developing when you're little. And so now this kind of continuum of appetite and satiety is all interrupted.
Right. And we have to learn on a whole new schedule.
Yeah.
So it depends upon a family that we might be working with that has other kids and other needs
Yeah.
versus now, or a family that can solely focus on one child. When do they need it? And so sometimes I even help with, let's come up with a plan of when we're going to offer food.
Yeah.
And it comes about, where are we going to offer the food at?
Yeah.
Where's the presentation going to happen? And there can be certain times where a kitchen or at a table can be a trigger. So we have to think outside the box. When are we going to offer that food?
And I think
where?
you've gotten so good at it, just with not just in all areas, but especially like feeding. That's the biggest thing that pushed me to have you do video calls for people also, because we'd have people come home and then the child won't eat or the child's overeating and things like that, and there was nowhere for people to turn. So so now we do.
I know.
Video parent coaching.
Some of those coaching calls have had the most success in a faster rate than seeing me in person, because at least over a call, we're explaining that a parent's doing all the feeding and I'm just explaining, well, try this.
So they don't have to be even in the state of Alabama to do parent coaching.
Right.
Yeah. So
I'm just coaching them through, what do they see? Because I can't see everything through that lens.
Right. Yeah. No.
I'm just providing them with what opportunities should they try. And so like a family today was just talking about, we just used the first then approach. We changed it from everyday life, but we used it with the food, and now the child will try anything through that approach.
And we'll have to talk about that approach, because most people probably don't know what first then, but it's a mode that you've taught me.
Yeah.
It's just a way to get a child to comply a little bit.
Right.
So can you tell us what first then is?
So like even for somebody, like if they're like, say they're not eating chicken yet, but they love their apples. So I would say first chicken, then apple. So I hold and to me it's about positive reinforcement.
Yeah.
You're going to get what you want.
Yeah.
But I need you to do this first.
Yeah.
So, and that's it. So you say first. So I sometimes will tell families, you know how when they first wake up in the morning, they really want you to go off and play real quick with them?
Yeah.
And I'll say, well, then you say first coffee, then play, then outside play.
Yeah.
And it can change your whole life, just because a lot of our families will tell us, that they want all that attention, and we don't want you to interrupt that attachment. But we also do know that, I know that parents have their own needs.
Exactly.
And
it's just a simple little technique,
right. And it works like a charm.
Yeah.
That, and my other favorite one is, it's closed.
It's closed. I've heard you say that so many times.
So like
it's closed.
So like if they want a certain toy, and maybe right now we can't get that out, like we're not painting right now. Now it's not a good time for painting. Then you go to wherever that cabinet was and they try to get the paint out. Oh, it's closed. Paint's closed. I really started that with my boys because they wanted to go up and down the stairs so much when they were younger. If we went to visit someone and they have stairs, and you get sick and tired of helping them go up and down the stairs, and finally stairs are closed.
I never knew where that came from.
That is where that came from. I would sit at the bottom of the stairs, where you block them off, and I go, stairs are closed.
Stairs are closed.
And they get closed. They understand what that meant. It's just not happening right now. Because there is only so much we can do. You want to meet the needs, but after a while, we do need to set some boundaries.
Yeah.
And so I feel like that's what I do in this role. I've taken on so much of what I've learned from you and what I've learned from our family therapist about need for boundaries, but also knowing when to push. But it's these little bitty pushes that can make the advancements, just like in development. I know that's probably another section.
It's coming up. The next one's coming up.
I know, I was just moving.
Before we go to that, I thought it was interesting, though, and we can also segue to this, is that knowing when to push, which is super important when you're trying to build attachment.
Right.
So I think that's how, like you were saying, like this is what's so different about when you do OT outside of our children, is you got to know when to push, but you're not going to disrupt attachment if a child's already
Right.
fully attached.
And I'm only doing it like today, for instance, just in a session, I had the family, but the family was present. So if the family is present sitting next to me, they can witness it, and the child still knows they're safe as I'm pushing them for 10 seconds.
Right, yeah.
And I explained to them the importance of because they live out of state, when they're doing their therapy, them being present. So if the families are present, then that also helps the child know they're safe. Mm-hmm. So then the therapist can read those cues as well. And it just helps the whole team learn how to push.
Yeah. And it's that hands-on, like showing the parent, this is how hard you can push, and this is how, this is when you need to back off, like and teaching that in sessions here.
I wish I knew, I don't know how to do that outside of one-on-one at this point, is because it's so difficult, but doing it in a one-on-one session, I'm able to show them, see how quickly they recovered, or, oh, they didn't recover on that. And that's a cue thing I know because I see it happening, and I know what to do when it's happening.
Yeah.
But I need that one-on-one time with a family to help them see it, because I don't want them to push too hard, because there's this fine line, and you got to find the fine line.
Yeah. Well, and then that does carry on to the next session of just general development support, general developmental support, general developmental assessments. Like a child newly comes home and they're, say, 4 years old.
Right.
Talk about, like, what do you assess in that moment?
So I'm going to look at, one of my favorite things to look at is just their play. Okay. Because with play and the way a child plays can tell me so much. Okay. I can see communication, whether or not they tell a parent or tell me what it is they want. Do they go over to it? How do they verbally or non-verbally show me what they like? And then I can see their attention to that detail. And then do they know what that toy is for? Like just basic with magnetiles. Do they know how that works? Do they know a ball and what it can be done with? Do they know the ball is for throwing, but the blocks are for building? Yeah. And I look at so I'm going to look at that communication. Then I'm looking at their cognition through that play.
It's just thinking skills.
All their thinking skills, yes. And some people call it that receptive and learning skills is what they're taking in when I tell them, oh, well, let's build it tall, and then we might knock it over with a car. But that's following directions. So I'm able to see, how are they thinking? I want to get inside their head and their brain and what is really happening, because I can see more of those little glimpses of what they're seeing, even when they may not have shown it to anyone else. And that tells me where we're going to go next. And then the nice thing is I'm also, of course, looking at gross motor coordination, how they're moving, crossing midline, what are we doing with weight bearing, what's our smoothness, that fluidity of movement, what does it look like, because that matters for a lot of our kids, especially for ones who have missed out on even just being carried for those months, that children are typically held and carried. There's a lot to be said for that. And then their fine motor coordination, how do they use their eyes and hands together for play? So a lot of our kids come home knowing cause and effect. I can push a button, it makes a noise. I can push a button, it makes a noise. But they don't even realize that they could, how to pick up something to hold, and then how to feed themselves. So then I've got to look at play versus how they're using those tools to how they're going to use it for function.
So really we're looking at, when you're looking at general development, you're looking at fine motor skills, gross motor skills, thinking or cognition, and communication. Those are the kind of the four pillars that I always think of it, that I'm always asking you about after you see a kid. So tell me what they were doing in those areas. And I think it's so important, because if there's a deficit in any kind of developmental area, then we always kind of say that it might be a little crack in their development, but if we don't fix it, then it becomes a gap, then it becomes a chasm. And so by third grade, you're just not able to keep up. Right.
And it's because we didn't start with a firm foundation.
So we got to build that foundation.
Right.
That foundation has to be really built. And so if I could get to every single preschooler, I know, and really make sure that we're not 10% delayed, 20% delayed, because we know what's coming. We know that it's
Right.
only going to get harder what we're asking their brains to do. And so it was really a big, huge part of the picture for these kiddos.
Right. If we don't even if we don't look at it ahead of time, if there's one area because of that communication
Yeah.
delay, but everything else can look good, but then what happens to them for the next step?
Right, yeah.
Yeah.
Because, and then two, it becomes another little trauma if they're behind in school because they feel inadequate. They feel like I'm
Right.
not caught up. They know they're not caught up. And that can lead to difficulties with behavior, which is our next section.
Right.
Our fourth area of your kind of specialty care is looking at behaviors and what, from a developmental perspective, is impacting this behavior dysregulation.
Right.
And we've kind of already touched on that, so we don't have to spend as much time on this, but it's like, I don't know if I could help families in near the effective way without your evaluation. Because I gotta know, like, where is this behavior coming from?
Right,
Is it
right.
coming from, is this ADHD? Is this autism? Is this low IQ? Is
Right.
this a speech delay that's causing tantrums? Any kind of little developmental abnormality is going to impact the whole rest of the
Right.
child.
Exactly. And then they just really have a domino effect, because if it's one thing and we look like we're sensory seeking, but it's because we can't communicate our needs,
Yeah.
then we have more tantrums, then that tears up attachment because of how we're all being perceived where we are.
Yes.
And then we're not going to learn because we've shut down. So any time we go
Right.
into shutdown or that fight or flight, then we're not able to learn.
Right.
And then it's just that domino effect.
Yeah.
And trying to tease that out, it's hard. You have to,
Mm-hmm.
I mean, it's not something we can do quickly, because it can look like one thing
Yeah.
and then change an hour later,
Yeah.
change a week later.
Yeah.
I think that's why we do what we do is so different, because
Yeah.
you may tell we're looking for something, and then I go, that's not what I see at all.
Yes. Well,
And-
that happens all the time. I
and-
think it's this. And
you
she'll go,
know,
I don't think that's that.
We have not had many of those except till lately. We used to have a lot more of those aha moments where we go, oh, that's what's happening.
Yeah.
And that's sometimes why we also, when we see kids, it determines on who they're going to see first.
Yes.
So we do it, we do that different when we do an interdisciplinary.
Yeah, because I might need to know, like, okay, I think this is the direction that this is going, the diagnoses that we're going to make. But I need you to go in there and look at the development first and tell me what's going
Right.
on, because that's heavily going to influence the outcome for me.
And I need to see sometimes what's happening with Kelly or Caitlin doing their
Yeah.
side of it, because I want to know what's happening in the dynamic of the family.
Right. Yeah.
And that aspect, because is there something there? Because I might see it and then blame it on something else when it's
Yes.
really twofold. So I have to admit, I mean, most of the time when I see the kids when we're doing that consult, I'm sort of seeing them through three different lenses,
Yes.
which we all are.
Yeah. Those three
I mean-
lenses being,
Yours, medical,
Medical.
physician, family therapist, and developmental.
yeah.
Because
That's
each of
interesting.
us all bring something different to the table. And
Yeah.
that is nice. I know. And then when I'm able to do some of those outpatient type one-on-one services,
Mm-hmm.
I'm able to tell y'all what I'm seeing as something changes.
Yeah.
And I love that, how we're all here, so that I can go, oh, I need to touch base with the family therapist on that. Like, or they're telling me about sleep. And I'm thinking, well, I am having this one area where we're kind of hitting a brick wall. I need to go talk to Dr. Chambers about that. And it's just so nice having us under one roof for that.
Isn't it? Yeah.
Yeah.
It definitely is.
And the families don't feel like we're disconnected because of that.
Yeah.
Right.
Let's hit the fifth area, because it actually deals with behavior too, is school interventions.
Yes.
Because one of your unique talents is you also still work in the school system,
Right.
and so you understand the school system better than any of us, and how to get good interventions in the school system, things to think of when
Right.
parents are considering needing more support from their
Right.
school system.
Just understanding where to start. Like sometimes with our families, they don't even know the right questions to ask or the right person to go to.
Yeah.
And they'll say, well, I tried it. And they said, no, we didn't need that right now. And
Yeah.
I'll say, oh, well, we really just need to go straight to the special education department
Yeah.
and ask for an eligibility testing. And I'll say,
Yeah.
oh, no, going to the principal's not where you needed to go.
Yeah.
I'd love for families to need to know. Going to your teacher, when you feel very strongly about it,
Yeah.
we want to do something about it. So go in and have an eligibility testing, which is eligibility for special education services.
Okay.
And you're determining whether or not you would benefit from an individualized education placement type program, which is an IEP.
Yeah.
So if they do that, then we're able to kind of figure it out. We do have to make a lot of recommendations for families to navigate that. And then sometimes I like it when they even bring in their IEPs and I can look at what behavioral strategies have they put in place.
Yes.
And are we treating this from a behavior standpoint with an attention deficit rather than an anxiety perspective? I see that a lot. And it's nice to be able to give them the tools and activities or ways of speaking to the child that will help build them up rather than tear them down. Because then you're going to see it at school. You're going to have the meltdowns at school, which honestly, school system wide, that is a new hard thing because parents are having a harder time understanding how to place limits.
Yeah.
So our kids already have a hard time placing limits, and then the world tells you to do one thing, and that changes their perspective again. And so, it's definitely something we have to look at. I love also helping to place them, like what grade should they go in, and what type of school, what type of teacher. Could we do a modified day?
Yes.
Should we do homeschool? Because every family is different. Nobody is the same.
And there's not one recommendation
Right.
that holds true for every one of our kids.
Exactly. And we do, and I think it's important that we do take into account what's best for the child, but we take into account what's best for the family.
Yes, exactly.
Because if parents, we strive for the family connection, and if the family's not connected, then we're harming marriages, and we're harming the whole family. And the families, we got to keep them all together. We've got to try.
And, I think the one thing I like about being, here in our own space is that there's creativity to do other things. Like you're now able to go into the school setting, and that's one service that you can offer now.
I love to go into the daycares. I had a couple of kids who just, the family was worried that they're about to be kicked out of a daycare. And even in the 28 years I've been doing this, I've had a lot of children and families who would come to me going, we need to hurry up and get in to see you because you're about to be kicked out of daycare. That was always their first meeting, that initial meeting. We're like, what can you do to help us not get kicked out of daycare? And so now I can go to the daycares and I can give them strategies, because I'm not going to tell them what to do per se, but maybe just little changes they can do in the classroom to help the child succeed and honestly help all the kids in that classroom.
Yeah, definitely.
Yeah.
Well, this has been a whirlwind to try and get all the areas in. I'll name them again: sensory processing, feeding therapy, general development, then behavior regulation, and school interventions. Those are your 5 big areas.
Those are.
So we'll do in-depth podcasts later on each one of that. That'd be super fun.
Okay.
So kind of in wrap up, we've kind of already, I was going to mention some of the red flags, like how would you know your kid needs occupational therapy? Maybe I'll ask that question anyway, even though we've kind of already answered a lot of that.
Okay.
But anything else that comes to your mind of how you would know if your child needs occupational therapy?
I think if you are struggling to understand what your child might need or want, and you're struggling to interpret actions, if you're having struggling interpreting with feeding, because you just wonder, are they eating this well, or what is happening here? When you feel that as a parent and you need somebody who might, to me, that's where I can help. Because I've seen many families who I might just give little strategies to help with their everyday life, because that's part of what I know as an OT, and it's not real just OT. It's just something that I have learned over the years because of this population and because our needs are so varied. But if they just are struggling to understand that need or want or behavior, why is this behavior occurring? You ask.
Yeah.
I'll tell you if we don't need ongoing therapy. That is one thing. I'm all for families. I live in the real world. I know how much a cup of coffee costs. And I always want to know more to help the family. So if I can teach them the strategies for whatever that need or want is.
And I'm always pushing you to see them more often
I
because I'm like,
know.
you don't know what you know that families don't know.
Right.
So
I like to take their lead. I want to take the family's lead.
Yes.
I want to know, do they feel that they need more hand-holding? And I'll always ask a family, do
Yeah.
you feel that you've learned today what you can try
Yeah.
to implement 2 things at
Yeah.
home to make their goals better? Because to me,
Yeah.
I'm going to work on what's important to the parent.
Yeah.
So a lot of interventions out there, they're going to go, well, you showed a 30% delay in this area. But if that's not impacting what's their concern, then I can explain that to them, how that might help. But I really want to meet the families where they are.
Right, and what they see as their needs are.
Correct. And what maybe some
Yeah.
interpretation of a child's behavior. What is it?
And I feel like one thing I want to add, and that's super important that we're really trying to hit even more here, is preventative care.
Yes.
Trying to come early. Because again, developmental skills build on each other. So if you don't have a strong foundation, it's really hard to successfully and easily move up in that
Right.
developmental progression.
And that's fun to do.
Yeah.
Just because teaching parents really how to play with their kids.
Yeah.
If we promote play in that turn-taking, attachment, communication style, you are preventing all the other things from occurring later.
Right.
And
yeah.
one of my favorite things is to teach families how to play. It's sort of a lost art because even families, young families, they just don't know how to do it as much. We're much busier.
Well, COVID totally
Changed everything.
with how we played with our kids for those years.
Right. And now just knowing, even if you can't get down on the floor,
Yeah.
how would you interact?
Yeah.
And what are those opportunities? Just like spending time in the car, talking about, did you see that big red truck go by? Oh,
Yeah.
big red truck. Or, oh, there's a little red truck.
Yeah.
I mean, you have to create opportunities. And
Yeah.
a lot of our children never had that for bath time, for feeding time, meal time,
Right.
playtime with the family. You can incorporate it during that time. But sometimes you need that little push to remember, oh yeah, I can do that. And sometimes our families jump too far ahead on development. They kind of forget. Everybody forgets what a 5-year-old really looks like.
Yeah.
Because schools, I say what I say around here, kindergarten is a new first grade, but they're not developmentally ready to be doing these first grade tasks. So we have to figure out a way to do it.
And sometimes you just need a second opinion, like outside of your own,
Yeah.
of just like, where is my kid? And a lot of people enjoy our preventative care because they can come in once a year, get a full developmental evaluation, and feel a comfort, like, okay, I was right. I thought we were on track, or I thought something was wrong. So
And I like it. I just give them so they have my email, and you can say, you want to shoot a question to me,
Yeah.
and then we'll make a follow up. Yeah, I'd much rather hit it quicker initially.
Yeah, definitely. Well, I've enjoyed being able to work a little different now that we're in the clinic, and you'll be able to do parent coaching, and you'll be able to see kids on an everyday basis, like all in your new gym that we have here for you. So, and thanks to Shannon Walchuk for
I know
sponsoring that amazing gym. So we really appreciate them. So, okay, well, thanks for being
you're
on
welcome.
today, Amy. And we
welcome.
will get back with you and talk about these areas in more detail.
Okay.
Thanks
you
for joining us on the podcast today.
Thank you for joining the Adoption and Foster Care Clinic for another episode of Beneath the Branches, a podcast for adoptive, foster, and kinship care families. We are deeply grateful to our sponsor, Show Hope, for their generous support and their continued work to break down barriers to adoption and support families every step of the way. Until next time, may you feel covered, connected, and never alone beneath the branches.